Hello and welcome to episode 70 of Not Reserving Judgment, a podcast about the latest intrigues, triumphs, and outrages in Canadian constitutional law. I'm Josh Dehaas, counsel with the Canadian Constitution Foundation.
I'm Joanna Baron, Executive Director of the CCF.
And I'm Christine Van Geyn, the CCF's Litigation Director.
In today's episode, I'll tell you about some teeny tiny steps BC and Alberta are taking towards freer trade between provinces and why that is a very good thing, particularly at this moment.
And I'll discuss a new report from the C.D. Howe Institute that ranks Canada's healthcare as second last among its peers. I mean, no surprise there.
And we'll share our bad legal takes of the week, where we take a lighthearted look at some legal opinions that didn't quite land. But first, I'm going to talk about the sad but unsurprising conclusion of one of the big lawsuits against vaccine mandates. And the CCF was not involved in this one for reasons that I think will become clear. To quote the judge, it included some outlandish claims. So this was a lawsuit from 473 plaintiffs who were suspended or terminated from various hospitals and other medical facilities in Ontario for refusing to comply with vaccine mandates. And this was after Ontario had directed hospitals to either require their employees to show proof of vaccination, an exemption, or watch a video about how good vaccines are and test regularly. And pretty much all of them just put in place policies that said, we're going to suspend or fire you if you don't get the vaccine. And this lawsuit was organized by a lawyer named Rocco Galati, who is somewhat notorious in Ontario legal circles for creative constitutional claims. This was no exception. So Galati argued that the province's directive breached nearly every charter right that exists without many details on how or why, and also said that the policies amounted to torts, including misfeasance in public office, conspiracy, intimidation, and intentional infliction of mental anguish. So the CCF would probably agree that the government-imposed mandates generally violate the right to security of the person and, in some cases, equality. And we fought them in British Columbia, where the vaccine passport system was particularly cruel and arbitrary. Amazingly, we still don't have a decision on that. But the very big sort of obvious reason why Galati's case here was bound to fail was that the vast majority of these employees are unionized. And when the essential character of a dispute is subject to the collective agreement, then the collective agreement process applies. And you can't challenge it directly in court. You have to go through the grievance process. Then you have to go to the labor board. If the conclusion's unsatisfactory there, you might seek judicial review, but that's going to tend to uphold the labor board. And so while it may not seem fair when a charter right like this is implicated, that is pretty well established how it works in Canada. And so it was always a long shot that that approach would succeed. Of course, if a union had refused to assist an employee with a grievance, and we know this does happen sometimes, then the employee can sue the union for failing in their duty of fair representation. But again, you have to go through the labor board, and it's unlikely to succeed most of the time. So that was one of the main problems. Another big problem was that he was trying to represent 473 people at the same time, but not as a class action. And the judge pointed out, well, these are all essentially wrongful dismissal claims. There are all kinds of different employers, all kinds of different policies, all kinds of different facts, and you really can't just consolidate this into one claim. Then there were some of the claims made, which were, to quote the language of the law, frivolous and vexatious. The judge also called them outlandish at various times. One was that these policies constituted a crime against humanity under international law. Okay, so then we get into the torts. For example, the judge asked, can the legal test for conspiracy be met here? And for there to be a conspiracy, there has to be a specific purpose. Then there has to be overt acts by each of the co-conspirators, and it has to lead to injury and damage. It's also intentional. And what you see here is the statement of claim says, quote, the defendants, so that's, Doug Ford and all of these public officials, do so, conspiracy that is, through the declaration of a false pandemic and implementation of coercive and damaging measures, including infliction of violation of constitutional rights as set out above in the within statement of claim, which has caused the plaintiff's damages. And Justice Conan, so this is the same judge from the U of T encampment decision, points out that, quote, the claim doesn't describe the relationship of the alleged co-conspirators to each other. It doesn't refer to any alleged agreement between the parties, does not refer to the acts that led to such an agreement, does not refer to the acts of each alleged conspirator in furtherance of the conspiracy. It strains all credulity to accept that the Premier of Ontario, a number of cabinet ministers, and 54 non-governmental defendants somehow conspired to concoct a plan to declare a false pandemic, all for the predominant purpose of harming the plaintiffs. And to me, that does seem right. Like, I agree with Galati that there were some COVID measures, including vax mandates, that went too far and were in some cases unconstitutional. Joanna and Christine, you wrote a book about this, and so you know well how many charter rights were violated. It was a lot. But the point is, was this a conspiracy to injure people, or was it just bad and in some cases unconstitutional policy, right? For example, the government of Ontario, if they were conspiring towards anything, it was just winning an election. It wasn't conspiring to actually injure people with their policies. Then we get into the charter claims. So there's just too many to talk about. But one was that the vaccine passports and their compulsory use to obtain goods and services, as well as travel on transprovincial routes by air, train, and water vehicles, was unconstitutional. And I'm actually open to this kind of argument that, there was that one of the governments went beyond their powers under the division of powers. But the problem here is there were no intra-provincial train vaccine mandates in Ontario. Go Transit commuter trains, for example, did not require proof of vaccination. So if he's making this sort of claim, he's actually just sued the wrong government. You should be suing the federal government if you think that the via train vax mandates were unconstitutional. Okay, so something else really interesting happened with this decision, and that's that a lawyer in front of the podcast, Ryan O'Connor, managed to assist one of the plaintiffs here who, it turns out, was not unionized, and so was actually able to make a relatively useful claim. So according to the decision, this woman, quote, says that she was never informed about the specific claims that Mr. Galati made on her behalf, did not speak with him, and did not meet him to discuss the individual circumstances of her claim, nor was she aware of the types of legal argument that would be made on her behalf. And according to Conan, Ryan has delivered a more conventional amended statement of claim that narrows the claim solely to this woman against her former employer, removes the allegations of charter breaches, removes outlandish allegations of false pandemics and crimes against humanity, and clearly pleads the necessary facts underlying causes of action in tort, contract, and breach of statute that she advances. So she's allowed to go ahead with her lawsuit, which is good. And then there's the real kicker here, which is the costs. So Ontario only sought $15,000 in costs, which seems a little low. I would guess they probably spent more than that. And all of these hospitals and other institutions sought much more. And Justice Conan was pretty happy to oblige here. He says, quote, the amended statement of claim is so outlandish and so far outside the spectrum of what is reasonable that there is no legitimate public interest in its pursuit. And he called it an abuse of public resources. And for that, he awarded the non-governmental defendants $175,000. So a pretty sad ending for a lot of people who were terminated or suspended for not complying with vaccine mandates, including, nurses who had COVID early in the pandemic and thought, well, I have immunity, so why should I be forced to get this vaccine? But, sad as that might be, it was a predictable outcome, I think, from the start. Joanna, you wrote a book about this with Christine. Is this bringing back any bad memories for you?
I mean, some. We knew when we set out to write the book, and also read back the book, that we were going to anger people on sort of both ends of this spectrum, because we were obviously very critical of vaccine mandates, which was a position, by the way, I'm not going to name names, but even in our own sort of circles, there were people who actually were enthusiastically in support of vaccine mandates. And their justification for it was this sort of Lockean idea of liberty, that your freedom ends at the point when it harms another person. And the theory was, if you are more likely to spread the virus in public places, if you're unvaccinated, then you shouldn't be able to go there. We never accepted that because my thinking was, as we're seeing right now, as we go through cold and flu season, where all of us have cycled through a few bugs in the last few months, you don't have a right to not catch a virus. I'm sorry. If you don't want to catch a virus, go become a hermit. So anyways, but I digress. So people on that side were annoyed by us and found us to be strident. But then, of course, people who went full microchip, full-on conspiracy. I've even seen people still saying that the whole virus was manufactured. I've even seen people, and because of my yoga life, I have some pretty fringe people on my networks who are even saying viruses don't exist. I'm not sure what their reasoning for that is. I have not asked. So clearly those type of people would be alienated by us as well. But the problem with this type of litigation, and I remember during the pandemic, friends of mine in the wellness scene were like, oh my God, have you heard of Rocco Galati? He's so badass. He's challenging all this stuff. And I'm like, he doesn't really have a serious reputation in the legal community, and this isn't going to end well. And the problem with bringing these clearly frivolous, unmeritorious overshoot cases is that it leads to these type of punitive cost orders, and it doesn't lead to good precedents. It pisses off judges, quite frankly. So I don't think that this is helpful. There are other organizations that I won't name that tends to do a lot of this type of litigation. I don't know if they think it's just lawfare and it doesn't matter if they have no reasonable prospect of success. I know that the financial consequences can be very prohibitive. And not just in this case, there's been a few cases like the JCCF's Seneca College vaccine mandate challenge, which resulted in a cost order that was so clearly the judge was so frustrated by the behavior of the parties that it actually had spillover effects into all public interest litigation. Luckily, we helped and intervened in that on appeal to have some of the bad precedent on that walked back. I don't know, Christine, anything else to add?
So I know that Ryan O'Connor is a friend of the podcast. I know he listens to it. So shout out to Ryan for your praise in this decision for your conventional claim. And honestly, for advocating for the best interests of your client. It does not serve the interests of your client to make widely reaching sort of conspiratorial claims, even if, perhaps your clients might like to attack, global leaders and Bill Gates and Hillary Clinton and people like that. It actually doesn't serve their interest to do so. So kudos to Ryan for not doing that and making a very normal claim that now is proceeding separately, and hopefully we'll have a good result for your client. I'm actually going to be interviewing Ryan about not just this case, but he has done a number of cases involving people who were employed in various fields at work from home, in a lot of work from home positions during the pandemic, and for whatever reason, usually religious reasons, declined to get vaccinated. And even though they were working from home, they were still terminated or disciplined in some way. And so I'm going to be speaking to him about the success that he's had for a number of those clients. A lot of them settle because it's just so wrong what happened during that time period. But I'm going to turn now to my news headline, which involves healthcare. And it's a new report. This is one of our favorite topics, is Canada's government monopoly healthcare system and sort of the various ways in which it fails patients. So the C.D. Howe Institute, which is a think tank here in Canada, they released a report that says our healthcare system has fallen behind its international comparators in a bunch of different categories. And the categories they measured were access to care, equity, and wait times. And they ranked us 9th out of 10 countries, so second last. The Netherlands and the United Kingdom did well on this list, And at the bottom of the list in those categories, access to care, equity, and wait times, was the United States. And look, we already know that Canada does really badly on wait times. This is like a perpetual news story, that how bad our wait times are. But access to care and equity, or so-called equity, those are what the defenders of our healthcare system cite as the reason we have this terrible system. You know, sure, wait times are long, but by the way, in this report on wait times, we were actually 10th out of 10. So these defenders say, sure, wait times are long, but we are good in those other categories. We have, quote, free healthcare and everyone has access and you don't pay your way to the front of the line. But in equity, Canada ranked 7th out of 10. About a quarter of Canadians with low or average incomes reported at least one cost-related barrier to accessing healthcare in the last year, which is double the rate of high-income earners in Canada. And the CD Howe report found that affordability was a significant barrier to healthcare in most Atlantic provinces, in Alberta, British Columbia, and the Yukon, where a lot of adults reported not going to get care or medications or mental health services or home care because of cost. And we also know that this narrative that affordability is not an issue is a false narrative, because if you are a wealthy Canadian and you have an urgent need for some type of diagnostic test or some specialized care, you get your two-tier healthcare by going to the United States. So we already know that this is an issue. Now, in healthcare outcomes, Canada actually fell slightly below average, with the second highest infant mortality rate in that list of 10, and the second highest 30-day in hospital mortality rate following a stroke. So that's quite bad outcomes, even if a lot of our other care is high quality. And this study was based on data that was collected from a different variety of resources, like the Commonwealth Fund, international surveys of patients, physicians, and the public, statistics from the WHO, from the OECD, and from the Canadian Institute for Health Information. So it's a great study. You can read it on the CD Howe Institute's website. And honestly, it doesn't surprise me. I don't know if it surprises anyone. I actually did a search on X or Twitter this morning for topics, searching for healthcare in Canada. And here's just a small selection of some of the posts on X. Someone wrote, Canada's healthcare is a disgrace. We pay a gross amount of money for less than piss poor service. Someone wrote, healthcare wait lists are getting longer in Canada. Nearly 75,000 Canadians have died waiting for various types of health services since 2018, and at least 15,474 patients in Canada died between 2023 and 2024 while waiting for a wide range of surgeries, procedures, or diagnostic scans. Now, that was a tweet, but it was actually also the front cover of the National Post today. So just honestly, any day of the week you want to find terrible stories about Canada's healthcare system, you can find them any day. And then I think my favorite was this one. Someone wrote, can a Canadian sue their provincial healthcare insurance plan for lack of adequate service? Example, long wait times. And that tweet links to a CTV article from today that said, I pretty well would have died on the operating table. A Canadian patient shares her ordeal on a long wait list for a colonoscopy. And that CTV news story is about a woman named Joan Hamma, who says she nearly died because she waited months longer than she should have for a colonoscopy. The best practice is to get a colonoscopy within 60 days of your referral. And she was on an 8-month wait list for a colonoscopy, which is a very common diagnostic scan. That delayed her colon cancer diagnosis. And about 4 months into her waiting period, she had this terrible stomach pain and her colon ruptured, and she had to go undergo emergency surgery. And the surgeon then removed this cancerous growth, and she needed to be resuscitated. I guess she died on the operating table, requiring resuscitation multiple times during that emergency surgery. This question that was linked in the article, can you sue? It's a really good question because the answer is a strange one, and it's one we've been involved in for a really long time at the CCF. And the answer is yes, you can sue. It's been done but with two bizarrely conflicting results between Quebec and British Columbia. So what we believe is that when government leaves patients languishing and even dying on long state-controlled medical wait lists, it does have legal consequences in Canada, or at least it's supposed to. And there's a very famous case from 2005 called Chaiuli in Quebec, and that went to the Supreme Court, and it concluded that Quebec's prohibitions on private pay insurance violated the guarantee against deprivations of life, liberty, and security of person. And you can access private healthcare in Quebec as a result of the Chaiuli decision. And in Chaiuli, the Chief Justice at the time, Beverly McLaughlin, wrote, "Access to waiting lists is not access to healthcare." And since then, you can access private care in Quebec. But what about the rest of Canada? You cannot. And this actually surprises people in Quebec. They don't know that the rest of Canada, you can't access private care because Chaiuli doesn't apply outside of Quebec. Even though the principles at play, life, liberty, and security of person, are protected under Canada's charter, Chaiuli was decided under Quebec's charter. So it is only binding in Quebec. And I think the problem is all Canadians should have access to healthcare, and that government action anywhere that has this effect of depriving life and security of person, that should be struck down wherever that happens, whether it's in Quebec or in British Columbia. But it didn't happen in a case in British Columbia called Cambie Surgeries. That case was one that we supported for many years, and it involved a private surgical clinic and a group of patients who had been on dangerously long wait lists and suffered adverse health outcomes as a result. And one was a patient who was 8 years old at the time, a young boy who was 8 years old when the litigation started, and he was left paralyzed after waiting on these absurdly long wait lists. Now, the Cambie litigation asked a really simple question, which is, does Chaiuli's reasoning apply to British Columbia and the rest of Canada? And the BC court really contorted itself. This was the Court of Appeal, contorted itself to find that basically an identical law between British Columbia and Quebec, the law that had been struck down in Chaiuli, they twisted themselves to find that it was constitutional in Cambie. And they found that long wait lists engaged the fundamental rights of life and security of person, but they bizarrely found that those deprivations are consistent with the principles of fundamental justice. And, when you compare this to some of the other case law on this, on life, liberty, and security, cases involving safe injection of hard drugs, brothels and prostitution, assisted suicide, that those prohibitions on those things are unconstitutional, but, a prohibition on getting a cancer treatment is constitutional. I mean, it's just completely bizarre. The finding that allowing a mother to pay for her child's spinal surgery in time, that prohibition stands as constitutional in the name of supporting this increasingly dysfunctional government healthcare monopoly. Now, we've written a book at the CCF about this topic. We've worked on it a lot, and we're giving away free copies of that book. It's called Healthcare Choice in Canada. I have a chapter in it. It's a collection of essays, and I have a chapter in there explaining these two competing cases, Chaiuli and Cambie. And there are other essays from other experts who talk about different ways that Canada's healthcare system can be improved, how it compares to European systems, and just, thinking creatively about how stories like that woman's about her colonoscopy, how we can fix that system and make it better. So if you want a free copy, we're giving out these electronic copies. They're available at the ccf.ca/healthcarebook. So you can go there and we'll send you a free electronic copy. Joanna, I know that this story of the conflicting cases in Cambie and Chaiuli is like one of your greatest frustrations in your work at the CCF. Is there anything you want to add to my description there?
Well, Your description was very thorough, but the one thing that I will add, which maybe will, we've talked about this enough, so I would assume that our readers get it. But just to put this into perspective, I was telling you guys on Friday, I was listening to a podcast that I think we all listen to called The Fifth Column, which we highly recommend. It's sort of libertarian-ish, witty, snarky American commentary. And they were talking about the very tragic LA fires, which I'm still like can't wrap my head around. And I have a lot of friends in LA, and it's just, anyways, just completely tragic and looks like maybe have been sparked by arson. But anyways, Michael Moynihan, who's who's a journalist and one of the podcasters, said that there is apparently a debate in the Los Angeles area, because Los Angeles is a very stratified place, I would say. It's like the nice places are like you're literally in heaven on earth, like Malibu. Well, I suppose not anymore, but Malibu, Pacific Palisades, like you have the mountains, the desert, the sparkling ocean, like you just can't believe how beautiful it is. But pretty much, and Beverly Hills, of course. But as soon as you get out of those areas, you're in like, and I'm very sorry to say, like kind of like strip mall, working class. Parts of it are pretty sleazy, especially like you cross from West Hollywood into East Hollywood, and it's just sleaze. But anyways, because it's so stratified, one of the big issues in LA is sort of how different sections, which are legally their own cities, like there's a city of Beverly Hills and a city of Malibu, because they have so much more revenue. Many of them employ private firefighters. And this is controversial because it's like, why would you use private money? Like, we need to pool all of our resources together. And that has the effect of, Malibu won't then send equal amounts of private firefighters all over LA. They just will scrap the plan to have private firefighters. So basically, as you see happen, everyone burns together. And if you could stop the fire earlier on, then you could stop it from spreading. So it would benefit everyone. And Moynihan analogized that to the Canadian healthcare system, where it's like, even though we know that there are individuals in Canada that could afford going outside of the public system, because many of them go to the US and other places to be treated privately, the Canadian government, federal government's line on this is that, no, even though we know we have these very sinking outcomes, it's more defensible to us for us all basically to suffer together. Like, it's just the lowest common denominator, without recognizing, of course, that there would be beneficial effects to the whole system if wealthy people were to spend their resources, which they're going to do anyways, to be treated in Canada. And if we could have private insurance so that not just the ultra rich, but maybe middle class or upper middle class people could afford insurance payment. Anyways,
yeah, I think everyone burns together should be like the motto for Canada's healthcare system.
Yeah. So anyways, he understood it perfectly. He even like referenced the Canada Health Act. So shout out to Michael Moynihan. I feel like this is very misunderstood both inside and outside of Canada. But yes, that is exactly what is happening. Sorry, that was kind of a long rant. Josh, anything to add?
It's a great analogy. I won't add much, but I will say I like this CD Howe report because it looks at all the dimensions of healthcare, including equity, which is the thing that, people who defend the status quo socialist monopoly system always say is what we're getting in exchange for, such harsh rules that keep out private care. But they measured that here, and, Netherlands, United Kingdom, France, Australia, Germany, Switzerland, Sweden, like I could go on, all of those beat all of our provinces on overall healthcare and also generally on equity. So what's the difference there? They have mostly public systems, or they have systems where people are, required to get insurance through their employers, but they also allow for private care for those who can afford it. And that acts as a safety valve for the public systems or the bigger pools of money, and it just works better. Like, people get better access to care, it's faster, it's more affordable overall, and that's preferable to everyone burning together. The second thing I'll say is I have a lot of conversations about healthcare with friends, and one thing keeps coming up, and I actually was accessing some healthcare myself recently, and this came up where, completely unprompted, the physician assistant started going off. And it's this idea that our healthcare system would be fine if we just had less immigration, because it's all these immigrants coming here using up our resources and our healthcare. And if we just got rid of those people, then we would have enough to go around. But this problem has existed for decades, right? So yes, that's putting the very high immigration rates are putting more pressure on the system than there was before, no doubt. But this is not a new problem. And I don't think you should just blame the immigrants, which seems to be what a lot of people are now doing. We really do need fundamental reform, like changes to the Canada Health Act. Joanna, do you want to take a break, or are you going to do your headline first?
Well, let's take a break. Okay, so there has been a recent modest victory for free trade and consumer choice in the wine industry, the cherished wine industry of Canada. So BC wineries are able now, once again, to sell their products directly to Albertans. And this comes after months of negotiation between BC and Alberta. And it demonstrates a small glimmer of hope of how interprovincial trade barriers can be overcome voluntarily through mutual benefit. So why does this matter? This will open up access to over 300 BC wineries for Alberta consumers, while ensuring, of course, that the Alberta government is still going to get paid, that it will receive its share of tax revenue. And it's a good example of how free trade can create situations that are win-win. So consumers get more choice, businesses gain market access, and of course, governments can maintain their revenue streams as they are wont to do. And this is actually resolving, it turns out, a contentious trade dispute. Last January, Alberta had blocked BC wines from direct-to-consumer sales, arguing that these shipments bypass provincial regulations and, again, reduce government revenue, which even in Alberta, they don't like. But instead of continuing this stance of protectionism, both provinces found a way forward that is to everyone's mutual benefit. So BC's wine industry generates about $3.75 billion annually. It employs 14,000 full-time workers. And by opening up the Alberta market, this deal obviously supports economic growth, further job creation. And the chair of Wine Growers BC, Paul Soller, called this a significant milestone for the wine industry in Canada and said that he hopes it can serve as a model across the country. And that's right. So this can lead to prosperity and cooperation between provinces. So it's a small step, but it's one that we want to shout out because this is an area that we are a little bit touchy about and have some personal institutional skin in the game about. So I'm referring, of course, to the case of the state versus Como, which is a case that the CCF litigated and took on, supporting Gerard Como, a New Brunswicker. In 2016, we won the challenge to a non-tariff trade barrier that New Brunswick was imposing. So essentially, New Brunswick ran a sting operation and caught Mr. Como bringing beer from Quebec into New Brunswick and slapped him with a fine under the New Brunswick Liquor Control Act. We won that case in 2016, and the New Brunswick Supreme Court held that Section 121 of the Constitution Act 1867, which guarantees intraprovincial free trade, prohibits both interprovincial tariffs as well as non-tariff trade barriers. And the court was departing from a line of precedents holding that Section 121 prohibits only the erection of outright facial tariffs or duties. But the court held that on the meaning and substance and historical context of Section 121, this was the appropriate finding. Now, of course, the Supreme Court of Canada the following year overturned this finding, and it held that as long as the provincial non-tariff trade barrier was connected to a valid provincial regulatory scheme, it would not run afoul of Section 121. Now, the issue with this approach, from our point of view, here I'm adopting my editorial voice, is that this constituted an approach that was so permissive that was so deferential to provincial non-tariff trade barriers. So they essentially said, as long as the pith and substance, the purpose of the provision is not aimed at reducing interprovincial trade, you're fine. That's kind of redundant because provinces already can't do that. That's a matter of regulating interprovincial trade, as Josh mentioned at the top, falls under Section 91, federal jurisdiction. Yes, provinces can't adopt measures whose primary purpose is to impede trade, which they already couldn't do. So, if the primary purpose of a regulation is to impede provincial trade, it is in pith and substance related to interprovincial trade. And we proposed instead a measure that a province should have some burden of justification. If they adopt a matter, even if it's part of a valid regulatory scheme that substantially impacts interprovincial trade, they should have to justify that the measure is necessary. But I digress. So let's get back up to 2025 and what is going on. We are a few days away from the inauguration of Donald J. Trump, who has raised the specter of imposing tariffs on U.S. consumers importing goods from Canada. And it turns out that our own domestic interprovincial trade barriers have the tariff equivalent of 21%. So we're freaking out about Trump imposing tariffs on our goods on American consumers, which is, of course, a tax on American consumers. And so we may have negotiating leverage, perhaps, but we can't really control that. It's not something that directly touches on us, although, of course, it will have a huge effect on our economy. But in the meantime, we have extensive interprovincial trade barriers that are doing pretty much just as much as damage. So the estimates of the economic costs of interprovincial trade barriers range from $50 to $200 billion per year. And it's also been estimated that the barriers add between 7.8 and 15% to the price of goods and services we purchase. And so look, nothing in the Supreme Court's decision in Comeau prevents provinces from voluntarily adopting free trade agreements in between themselves. The court was trying to balance provincial jurisdiction with Section 121, the free trade provision. But they are certainly welcome to conclude voluntary free trade agreements, and it's to everyone's mutual benefit. So we hope that this will plant a seed. This is becoming increasingly existential for us. And yeah, people in glass houses shouldn't throw rocks of creating our own, shooting ourselves in the head with these interprovincial trade barriers, which harm us as much as a potential Trump tariff. Josh, I know that this is sort of in your wheelhouse. Anything to say? Am I making way too much hay out of this tiny wine agreement? Am I just looking for a silver lining, ever the optimist?
No. We need to make progress on this. It's really stupid that we haven't so far. I'm sure we'd be interested in taking on a case if we can find the right one. We did have a case before. The name is escaping me, but it's a craft brewer that challenged
Artisan Ales.
Mm-hmm.
Yeah, that's right, Artisan Ales. So maybe Christine, you want to talk about that in a sec. But if these tariffs from Trump go through, and I'm like in the camp of thinking, yes, they're real, and he really is going to do it. It is kind of Armageddon for Ontario's economy in particular, and for a lot of the Canadian economy in general. But there's lots we could do to fix our economy at the same time, and this is one of them. Like a new government could do like sort of shock therapy if it had provinces on board, where you take down these interprovincial trade barriers, you get rid of all of the rent-seeking at the federal government, whether it's telecom, airlines, banking. You say, no, we're not going to do these extreme reviews that prevent mining and new oil and gas projects, and maybe we come out ahead of where we are today if we do some sort of like shock therapy. Argentina is going through this. They've got a new government, and they've said, no, we're going to cut the size of government, and we're going to get rid of all these regulations, do it all at once. And guess what? It's working. Their economy is growing fast. Their inflation is way down. Everybody's investing in Argentina. So if this really happens, we do have an opportunity to sort of make the best of it and come out ahead.
So, Josh, I know you prefer Ontario wine to British Columbia wine, and I think you're like legally obligated to say that because of your family, who works in Ontario wine. So I know that your preference would be a trade agreement that has more Ontario wine going everywhere, but I think I do think this is a really good small positive step. The Artisan Ales case is from 2017. So I'm trying to like very quickly refamiliarize myself with it. But basically, it dealt with a government of Alberta discriminatory tax and subsidy regime that violated the agreement on internal trade in Canada. And I do think it was this case, but I'm not 100% sure. So I'm going to look it up after this. And if I'm wrong, I'll put it in the notes. But the thing that Joanna brought up about how in Como, the provinces can regulate alcohol if it's kind of, this regulation of it's not really about trade, it's about health, which is within their jurisdiction. And this is a big get out of jail free card that governments can use to kind of surreptitiously actually engage in trade regulation. It's really difficult to catch them. But I believe it was in Artisan Ales that documents were obtained where it was internal Alberta documents that essentially said, we are doing this for the Alberta alcohol and craft beer industry. And they were kind of caught red-handed doing exactly what they're not supposed to be doing, and then claiming it was for some other reason, not about trade. But it's almost impossible that you would normally catch someone doing this. I mean, it's just, it was just so fortuitous that we were able, that those documents were disclosed and available. I'll turn now to our bad legal takes. My bad legal take goes to the federal government, and specifically to former Minister of Democratic Institutions, Karina Gould. So Blacklock, which is this investigative reporting outlet, they reported that Minister Gould gave a $369,000 government contract to a group called Media Smarts for, quote, fact checking. And Blacklock's described this program as designed to discourage the media and the public from, quote, questioning government authority. So researchers under this program stress the importance of invoking Canadian values to avoid being seen as liberal partisans, and documents obtained through Freedom of Information requests by Blacklocks shows that these researchers encouraged media and the public to avoid questioning government advisories. And the documents say, our review drew on literature on social norms, which established that a very small number of dissenting voices, in some cases even just one, can weaken the power of a normative belief. For this reason, we made a central part of our messaging the idea that any response to misinformation or disinformation, including very low risk examples such as asking a question, could have a significant impact. So just asking questions is wrong. The contractor, Media Smarts, ran a campaign called Check First, Share After that encouraged media and the public to closely follow government announcements. And even non-government experts who criticized federal advisories were suspect. According to this reporting by Blacklocks, the Media Smarts organization said, trust information from official government sites. I mean, this is bad enough, of course. We don't want to pay taxpayer money to any group that tells us we should refrain from questioning government authority. But this group, Media Smarts, is especially funny to me, not because like I have any real objection to this organization, but when you look at who's on the board, it kind of just is like, what is the Trudeau government thinking? The board includes representatives from various social media companies like Meta and TikTok. Now, obviously, I use those platforms. I don't hate either of them. But as we know, Meta was under tremendous pressure from the Biden administration during the COVID pandemic to remove content that went against the mainstream narrative. That has all subsequently come out, and sort of Zuckerberg from Meta has now said, he's going to be anti-censorship. He's not going to cave to government pressure to censor anymore. But it kind of shows their involvement in that kind of fact-checking infrastructure. And I understand why the government wants them even closer on this. But the funnier one to me is TikTok, because the Canadian government just ordered the shutting down of TikTok's Canadian offices, which, by the way, is something I oppose. I don't think they should do that. But what is even happening here? The government thinks TikTok is so dangerous and evil that they can't be in our country, that they ban them from federal employees from using them on government devices. But TikTok is good enough to be involved in running a government contracted fact-checking program. They're not running it themselves, but they're involved on the board level. So, I'm not mad at TikTok about this. I just don't know what the government is thinking when it does all of these conflicting things. So for Gould's fact-checking program and for the way it's all structured, that gets my bad legal take this week. Joanna, how about you?
Okay, well, first of all, shout out to, what's your dog's name again? Oh, Nova.
Nova. Oh my gosh, it's driving me insane.
Nova.
Can we see Nova? If we
No,
can hear her.
Losing it.
I let her off her leash just 5 minutes ago while I was talking, because she wouldn't stop hitting me with her paw. So now she's upstairs barking. Those dog obedience classes are really paying off.
Live your life, Nova. I just wanted to shout that out. If you hear that in the background, it's a very, very
9-month-old puppy.
Yeah. Okay, my bad legal take of the week goes to Canadian Health Minister Mark Holland, who just issued a new Canada Health Act services policy interpretation letter, which is a pretty rare thing. And the letter appears to be clarifying that nurse practitioner services or pharmacists, and we're going to zero in on nurse practitioners, will be covered by public health insurance. Now, currently, nurse practitioner services are almost entirely delivered privately. And so dumping this on the provinces, who are, of course, responsible for administering healthcare, has created essentially chaos, that all of these services that have not been part of provincial health budgets presumably now have to be encapsulated by them, or the provinces will open themselves up to clawbacks under the Canada Health Act. So just sending the system into confusion and chaos, and privately delivered nurse practitioner services, I think, are great, and are an option under virtual care platforms like Maple. I don't see why Holland did this, and there's already indication both from private businesses like Maple that they weren't consulted about this, and I don't know how provinces are going to accommodate this in already stretched budgets. And then second thing that Holland said, at least on X, his lead to this new guidance was that Canadians should never have to pay for the healthcare that they need. As though we don't pay for this healthcare, as though our healthcare insurance expenditures aren't one of the highest as a portion of total GDP in the world. So just because we don't pay for it directly doesn't mean that we don't pay for it. So sending the Canada Health Act into further uncertainty. The Canada Health Act says that the public purse pays for medically necessary services, but it doesn't say anything about healthcare adjacent practitioners like nurse practitioners. And of course, this often repeated and grade 10 level falsity that we do not pay for healthcare in this country. Bad legal take, Mark Holland.
Yeah, I agree. So my bad legal take goes to Max Fawcett, who responded to my very viral tweet from last week or earlier this week, saying that at a time when Trump is joking about wanting a 51st state, we should have been nicer to Alberta because they've forked over $240 billion in transfer payments over the past 11 years, which have funded social programs in lower productivity provinces, and in exchange, they've been treated like pariahs. So this tweet really struck a nerve with Albertans. There's 600,000 views and counting. I've definitely got some fans in the Wexit party now. But Max, who is an Albertan, but who is of the Liberal Party persuasion, decided to respond. And he said, I genuinely can't tell if this lawyer doesn't understand how equalization works or is just pretending. Either way, Alberta hasn't forked over anything. Taxpayers in Alberta have paid the same federal tax rates as everyone else. Also, the feds bought them a pipeline. So, ironically, just as Max was trying to lib-splain equalization to me, I was actually working on some litigation related to equalization, and I can't say just what yet, but I guarantee Max I know far more about how equalization works than he does. And yes, obviously Alberta doesn't directly make transfer payments in the form of checks to other payments, but what he's saying is like saying a person that earns $200,000 and pays 50% in tax hasn't transferred any wealth to someone who earns $30,000 and pays 10% tax when the government is going to spend $10,000 on healthcare for both of them. Like, obviously, the high income earner didn't send a check to the low income earner, but he or she might as well have. It's their money being transferred. So for those who don't know, and it's understandable because it can be a bit dry, equalization works. The way it works is that the government each year will measure how much tax is being taken in, all sorts of different taxes, plus up to 50% of resources revenues, because those tend to be very high for some provinces and very low for others. And if a province's fiscal capacity per person after taking in all these taxes is lower than the average fiscal capacity across all 10 provinces, they're going to receive some payments made up of money from taxpayers in the provinces that have the above average fiscal capacity, which tends to be, Alberta, Saskatchewan, and sometimes Newfoundland and Labrador. And there are some adjustments made to make sure that provinces aren't dinged too much for their natural resources, because it doesn't take a genius to figure out that if you, tax all of the extra oil and mineral wealth away from a province like Alberta, there's basically no incentive to go and dig that out of the ground or mine it or whatever. And so the calculation includes some consideration of that. Of course, the whole concept of equalization, to cite Section 36(2) of the Constitution Act 1982, is to ensure that, quote, provincial governments have sufficient revenues to provide reasonably comparable levels of public services at reasonably comparable levels of taxation. So it's odd, and I would say incorrect, for Max to suggest that Alberta hasn't forked over anything to other provinces, because they have, a far more productive economy per capita. And that means that each year they end up sending billions and billions, this year in excess of $25 billion to provinces like, Quebec and Prince Edward Island. The whole point, which is literally written into the Constitution, is to shore up other provinces. And let's not even get into the whole pipeline issue of why the federal government had to end up buying that pipeline. So Max, yes, bad legal take. Alberta is handing over tens of billions of dollars per year. And even if it isn't transferring that straight up through a check to Quebec, it's the same damn thing. All right, so that's the show. Thanks everybody for listening. As usual, we'll ask you to rate us, review us, and subscribe if you haven't already. We have a very high rating, and I appreciate that. You can support our work by subscribing to the CCF's YouTube channel, which is closing in on 100,000 subscribers. Pretty amazing work by Christine. And you can visit our website, where you can sign up for our Freedom Update newsletter if you haven't already. Each week you'll get updates on, what we're doing, and also a list of legal news stories that a lot of people seem to like. The CCF is a nonpartisan legal charity funded by your donations, so please click that donate button on our website if you can. Thanks for listening.